How is conductive hearing loss fixed by surgery? Imagine a world where sounds are muffled or blocked, making everyday conversations and noises hard to enjoy. Conductive hearing loss happens when something in the outer or middle ear prevents sound from reaching the inner ear properly. Luckily, surgery can often help restore this pathway by fixing the structural issues that interfere with sound transmission. One common surgical procedure is called a stapedectomy or stapedotomy. This surgery is mainly used for otosclerosis, a condition where abnormal bone growth fixes the smallest middle ear bone, the stapes, so it can't vibrate. During the operation, the surgeon carefully removes all or part of the stapes bone and replaces it with a tiny prosthetic device. This prosthetic acts like a new stapes, allowing sound vibrations to pass through and reach the inner ear again. The procedure usually takes about 1 to 2 hours and is often done as an outpatient surgery, meaning patients can go home the same day. Hearing improvements can often be noticed after a few weeks as healing occurs, and this surgery specifically targets the conductive component of hearing loss caused by otosclerosis. Another common approach is a myringotomy with ear tube insertion. This procedure is often used for children or adults with persistent middle ear fluid or infections. The surgeon makes a small incision in the eardrum, called the tympanic membrane, to drain excess fluid. A tiny ventilation tube is then inserted into the opening to help equalize pressure and prevent fluid buildup. This simple outpatient procedure can significantly improve hearing by clearing the pathway for sound. It is quick, usually taking less than 30 minutes, and is effective in restoring hearing in cases of fluid-related conductive loss. Tympanoplasty is another surgical option that repairs a perforated eardrum or reconstructs damaged middle ear structures. If the eardrum has a hole or tear, repairing it restores the normal transmission of sound waves. Sometimes, the surgeon also repairs or replaces damaged ossicles, the tiny bones in the middle ear, to improve sound conduction. This surgery can be performed through a small incision behind the ear and typically takes about 1 to 2 hours. The success rate for hearing improvement is high, especially when the damage is limited to the eardrum or ossicles. When the middle ear bones are damaged or missing, surgeons can perform ossicular reconstruction. This involves replacing the damaged bones with prosthetic ones made of materials like titanium or plastic. Restoring the mechanical linkages in the middle ear helps transmit sound vibrations more effectively. This procedure is often combined with other surgeries like Tympanoplasty for comprehensive repair. In cases of congenital malformations such as microtia or atresia, where the ear canal is underdeveloped or absent, surgery can create a new ear canal and reconstruct middle ear structures. This complex process may involve skin grafts, implants, or prosthetic devices. The goal is to establish a pathway for sound to reach the inner ear, but these surgeries can be more involved and may requiring multiple procedures. Risks include facial nerve injury or residual hearing loss, so careful evaluation and planning are essential. In summary, surgical options for conductive hearing loss focus on repairing or replacing the structures that block or impair sound transmission. The choice of procedure depends on the specific cause, whether it's abnormal bone growth, fluid buildup, a perforated eardrum, or congenital issues. While surgery can greatly improve hearing for many people, it's important to consult an ear specialist who can evaluate individual cases and recommend the best treatment plan. Always seek professional medical advice to ensure safe and effective care tailored to your needs.